Now I'd like to introduce Cindy Laws, our lobbyist. She joined Healthcare for All Washington in 2019, 3 days before the hearing of our priority legislation that year, and immediately went to work helping to strengthen the Pathway to Universal Healthcare bill. It ultimately passed as a budget proviso, and we are now seeing the fruit of that work in the Universal Healthcare Work Group that is nearing up its 1.5 year long schedule of work. This year, she helped us strengthen and pass several important bills that we had incubated, and those were covering capping insulin copays and setting up a work group to study total insulin costs. Cindy is a longtime policy wonk and previously served as Executive Director of Healthcare 2000, Healthcare for Washington's Washington's predecessor organization. Before that, she served as a staffer in the U.S. Senate and Congress. Please welcome Cindy Laws.
Hi, everyone. Thank you very much for coming to this annual meeting. It's so great to be able to talk to you all about the tremendous progress that we've made in the past 2 years. I'm going to go fast, so hold on to your horses here. We passed, as Marcia mentioned, we passed quite a package of bills. In the past 2 years, we've passed 8 bills. And this year, we have a specific goal with 4 insulin drug affordability bills that we worked on in advance with Senator Karen Kaiser and with Representative Eileen Cody. The bills included Senate Bill 6087, which caps insulin copays at $100 for a 30-day supply. At the end, we did push an amendment to try to lower that to $30, and that may be something that will continue moving forward in the future. House Bill 2662 established, in addition to the copay cap, it established a total cost of insulin work group. And that work group is really key because the goal here is to have bulk purchasing, the state using bulk purchasing to buy insulin. That program came out of what we lobbied during that bill. Was we pointed out that the childhood vaccination program that we have in the state of Washington provided the great model to which we could do bulk purchasing. That's how our vaccines for children are purchased. So it's been a very successful program for many, many years, and Senator Kaiser ran with that when we talked about that. Another bill that we supported was 1608, House Bill 1608, and this prevents religion-based providers from limiting information on patient options. And this is really important because as we've seen the consolidation of major medical facilities like Chi Franciscan taking over many hospitals, this prevents those entities from preventing patient information on things that those entities may not approve of, like death with dignity, abortion, or other options. This bill that was so important to pass prevents them from limiting access to that information. This actually kind of ties to earlier federal legislation back in the early 90s, which were gag orders, preventing doctors from talking even about abortion. So this is a similar kind of bill to that. Another bill that was a wonderful surprise that was promoted by 2 Republicans was House Bill 2464. We quickly jumped on this bill and met with the sponsors of the bill to enthusiastically support it. And it limits the maximum amount a purchaser of prescription medication can be required to pay at the point of sale. And that is really important because there's so many different prices being jacked around for consumers. And this really helps limit that maximum amount and makes things more consistent. Another one we pushed was House Bill 2457, which establishes the Healthcare Cost Transparency Board that will annually calculate the total healthcare expenditures in Washington and establish a healthcare cost growth. This actually is one of the most important bills that didn't get a lot of attention, but it really is critical because one of the things we know is that the huge variance in cost transparency. One person in Seattle may pay $1,400 for an MRI, and in another part of the state, it may only be $400. So having this be more transparent can really help actually get to a point we can control the costs and prices of healthcare. It's going to be very difficult to cover everything until we can better control the prices that are charged. And finally, our other bill that we passed this year was Senate Bill 6088, and it established a drug affordability board. Sadly, even though it passed both houses and the floor and everything else, it was one of dozens of bills vetoed by Governor Inslee when it became apparent that the pandemic was causing a budget shortfall. And about that budget shortfall, it's now $4.4 billion. It's much better. That's actually good news, because back in June, it was forecast to be $8.9 billion. So the federal stimulus money that came into people's pockets and the huge extra $600 a week people were getting on unemployment for those several months, they turned right around and spent the money. And that, since our tax system is based on sales tax, people spending the money helped level out the budget crisis. So it wasn't nearly as bad as it had been projected earlier. We're hoping something similar will happen with the next stimulus. But right now we face going into January with a $4.4 billion budget shortfall. And that will put a cramp on some of the things going forward, with Representative Riccelli will address. I want to talk about how you will recall earlier this summer, prior to the primary, we had asked all of the candidates running for the legislature to answer a question on whether or not they would support and pledge to support a bill on publicly funded universal health care. We took the records of those people that did, and to be very clear, we have a majority of the Democrats in both the House and the Senate did sign that pledge. That's wonderful to know going in to the legislative session. But particularly, we awarded healthcare champions to these representatives and senators who not only had signed the pledge, but have consistently sponsored our bills and voiced support for universal health care that's publicly funded. And they include Senator Derek Stanford, Representative Marcus Riccelli, Senator Bob Hasagawa, and these are in order of their districts, by the way. Senator Sam Hunt, Senator Christine Rolfes, Representative Steve Tharinger, Senator Jeannie Darneal, Speaker of the House, Lori Jenkins, Representative Jake Fay, Senator June Robinson, Senator Lisa Wellman, Representative Tana Sen, Representative Nicole Macri, Representative Frank Chop, who's the former Speaker of the House, Representative Javier Valdez, Representative Jerry Paulette, and Representative Deborah Entenman. I also want to call attention to many, many Republicans. Last year when I spoke at the annual meeting, someone asked me about our enemies and how we deal with the enemies. And I responded that I don't view any legislator, maybe one, but I don't view legislators as enemies. I don't view people that other people would view as enemies, because it doesn't help us pass legislation. Last session, many, many Republicans supported our legislation. On House Bill 2662, which was the bill sponsored by Representative Maycomber, Representative Maycomber is one of the most conservative members of the state legislature, a Republican from Northeast Washington. But her infant, during the legislative session, went to the hospital with it turned out that he was type 1 diabetic. And that experience that she had in trying to find and get care for her infant really showed what happens when we bring these stories directly to legislators. Healthcare affects them, and there actually is a diabetic caucus in Olympia. And so she was one of those that helped advance this very important bill. And Representative Maycomber made progress. But special friends included Senator Ron Muzzall of the 10th District, who did win his Senate seat. He was with us on almost every bill but one. One vote, he didn't vote with us, but every other bill, multiple votes, he was with us. Representative Joe Schmick was with us almost every bill, as were Representative Michelle Calder and Kelly Chambers, and Representative Paul Harris. The four of those Republicans all sit on the Healthcare Committee in the House. I also want to call out Mike Steele, who's up in the Chelan County area, for being with us on most of these votes. We're going to continue to expand our relationship with all members of the legislature, and we'll look forward to some new folks. The House, and particularly the Senate Healthcare Committee, are going to have a lot of new faces. So it's going to be a lot of relationship building forthcoming. And that's why we need to make sure we can expand our capacity going forth. Coming forward in the 2021 legislative session, we're going to be pushing bills that did not pass last year, but were really solid bills that we were pushing. They include a primary care collaborative. It includes a bill pushed by the insurance commissioner to have a fee on nonprofit health insurers with excess revenues. And this, for example, Regents and Premera are nonprofit health insurers, but they have billions of dollars in reserves just in the state of Washington. The fees on these excess revenues would help cover people who don't qualify for health insurance subsidies currently, but they can't afford the lowest cost health plans on the exchange. So it fills this donut hole. Representative Riccelli's bill will help provide premium assistance to those people. And most importantly, we're looking to advance the expected outcome of the Universal Healthcare Work Group. As you remember, the Universal Healthcare Work Group was created as an outcome of the 2019 Pathway to Universal Healthcare bill, which passed as a budget proviso. The work group includes 33 members. 6 of those members are from Healthcare for All Washington. We did a phenomenal job of packing the work group. At least 3/4 of the work group are in favor of Model A, which is one of 3 models that the facilitators have put forth for study. Model A is the publicly funded universal health care program. Most importantly, the actuarial study that came out of the work group shows that in the first year, the cost savings of insuring everyone in Washington is $2.476 billion less than is what is being spent now. Covering everyone costs less. We've known that for a long time, but we've got studies that show it. The savings actually increased to $5.7 billion per year in future years. So this is going to be our big push. Again, we're going to need extra money to help make this across the finish line. Concurrently, we've been meeting with our federal delegation, and it was really important to pass on some messaging that we got from Congressman Adam Smith. Congressman Adam Smith is one of the most important people. He's chair of the Armed Services Committee. An enormous amount of healthcare legislation goes through the Armed Services Committee. He actually does handle not only all the active military, but also the veterans. So after passing another stimulus, that's the most important thing that they're going to be doing right away is the stimulus. But after that, the next most important thing that Congress is aligned on doing is strengthening the Affordable Care Act. The next thing that they're going to focus on is passing HR 5010, which is the state-based Universal Care Act. This is a top priority for us. It has necessary waivers for ERISA and other waivers that will empower states to pass their own healthcare bills. This is what we need to pass, the Pathway Work Group stuff. These waivers were identified as the work group as crucial. The drug affordability bills that are in Congress, such as HR 3, are also likely to move forward. There's broad consensus on those bills. There's broad consensus on some other areas as well. Finally, SCOTUS, the Supreme Court and the Affordable Care Act. By now, most of you have probably all heard that the Supreme Court hearing was a lot more favorable than anybody expected. It's not a crystal ball. We don't know for sure how they're going to rule. And they won't issue a ruling until probably some spring, maybe late winter, but most likely early spring. But the questions that came out of Brett Kavanaugh, of all people, really indicated that they weren't inclined to overturn the bill. They commented, as Chief Justice Roberts noted, there was a lot of comments and questions about the fact that had Congress wanted to overturn certain things, they could have done so in Congress, and they did not do that. So that's really bears well for us in making this thing go forward. But strengthening the ACA, the biggest part of that, to go back to the federal legislation, is areas where there's broad consensus on, no matter whose party, and that consensus includes making sure that pre-existing conditions are covered. And so things are looking good for us. We have a lot of work to do. It doesn't slow down for a nanosecond. The champagne bubbles had barely lifted away from when we're starting to chill the next bottle of champagne for the future victories that we're going to have. So I'm glad that you're all with us. I'm really grateful for all of the support. I want to mention again, Marcia talked about the op-eds that we published. The importance of those op-eds was that the timing of them, we strategically timed these op-eds so that, and we urged in the op-eds for people to comment on the work group, and they did. 140 public comments were made. after the August meeting, and the majority of those came right after the publication of our op-eds in the Everett Herald and the Spokesman Review. We also got it covered in the Nisqually paper. So it works. Those are your efforts, your calls to legislators, your emails. Again, we have to keep moving forward. Every step that we make forth in healthcare is a prominent step moving forward. And just to remind everybody, this isn't new. Public funding of healthcare is not new. Maybe universal isn't new. It's over 100 years old that it was proposed by candidate Teddy Roosevelt. But President John Adams was the first person who passed public funding for a healthcare element. It keeps happening. It keeps moving forward. Don't be discouraged. We won the presidency. We hold strong in the state house and the state legislature, and we still have a majority in the states and the US Congress. We can make this happen. Dig deep, push forward, and fund deeply. So with that, I'm going to introduce now, I'm going to introduce Kevin Wren, and I'm going to introduce Patty Cooterer. If we have Patty on, we're now a little bit ahead of time, so I'm not sure, Kevin, or Ronnie, rather, you've seen Patty jump on. Senator Patty Cooterer is a senator from Kirkland, Redmond, and Bellevue. She has told an extraordinary tale when she was testifying on the floor of the Senate in favor of the Pathway Bill. And Senator Cooterer doesn't sit on the Healthcare Committee, but her story had everybody in the Senate gallery wiping away tears. And I'm not going to get into the details of the story. I'm going to let her tell her story. But it was truly powerful. The other person I want to introduce is Kevin Wren. Kevin was one of these people that when you testify in bills, when you have folks there, you get to work with the people that you may not know. You hear their stories and you're moved by the stories. And as long as I've been working in this stuff, which goes back to the 80s, I still get touched by people's stories. It shows the power of the individual stories. Kevin is a type 1 diabetic, and he told his story about trying to purchase insulin. And as young people, the amount of young people that are dying from not being able to afford their insulin, his story was compelling. So I reached out to Kevin, and over the next several months, we worked together on passing these bills. We're so impressed with Kevin and his passion and his articulate nature and the other organizations that he worked with that we asked him to join some of our committees and to work with us. And then we were so impressed with him, we asked him to join our board of directors. And I'm very pleased to have Kevin Wren working with us. So Kevin, take it away.
Thank you, Cindy. And I'd ask that anybody submit questions to the Q&A so we can ask Cindy some questions. Please fill them in, and I'll ask Cindy.
Bring it on. Bring on the questions. One of the questions I know that people ask all the time is about, does this incremental thing work? And I want to address that a little bit just outright, because while a lot of people want to have the big bang, they want the big bang, they want the big thing. But again, that's part of the reason why I emphasized that Teddy Roosevelt was campaigned on universal health care. That was a long time ago, 100 years ago. We've had bills covering to have universal health care coverage introduced in the US Senate and in Congress every year since the 1940. It took, speaking of incrementalism, Social Security took many, many years to go. While it passed initially, it wasn't very broad. It wasn't until 1964 that the bill was substantially expanded. And it continues to be expanded. So these are some examples of how incrementalism happens all the time, and it continues to move things forward. So we'll look forward to some more. So I see a question on more on the bill to increase premium assistance coverage. This one, actually, Gary, thank you for that question. And I'd like you to ask that question when we get to Representative Riccelli, because that is one of his bills. And we're strongly supporting that bill and want him to reintroduce that bill in the upcoming session. So we can hold off on that one. Anyone else has any more questions coming up?
Any more questions?
So we want to hear about the healthcare transparency bill. We want to talk about this was a bill that the healthcare transparency bill was a really important bill. It had a lot of support, and yet what happens, of course, I'm not sure everybody understands how many bills get introduced every year. There are roughly 5,000 bills that get introduced each year. And the caucus leaders in both the Republican caucus and the Democratic caucus in the House and the Senate, there's 4 caucuses, they will kind of determine which bills are the most important to pass. So the bill that we're talking about here was the healthcare transparency bill, which was 2036. It died on the floor of the House, meaning that it had passed the healthcare committee. It passed the healthcare committee 9-6, the House Healthcare Committee. Then it passed the Appropriations Committee 19-12. It passed the floor of the House 56-42. There was, and then when it went to the Senate, it passed the Healthcare Committee by 7-3. And so it appeared that this bill was going to be going gangbusters, but they just ran out of time. And this is the challenge every year when there's a short session. Those of you may not always follow this as closely as crazy people do, but the session last year was a 60-day session, which means you're already under the gun, and trying to pass a bill to go all the way through both chambers in 60 days is really tough. The bill had strong support. It wasn't super bipartisan, but it did have strong support. So hopefully we can get this bill going again. There's a little bit bigger majorities this time, and hopefully it can find a place in the priority list. There's a lot of priorities that are taken up this time, but hopefully we can get this one done. As far as the next question about each legislator limited just 2 or 3 bills, I don't think that is really enforceable. That every year they try to make sure legislators are managing their own expectations on how much that they can get accomplished. I think that people may introduce more bills, but whether those bills actually get heard is going to be tougher. The biggest challenge I see in the coming session isn't the number of bills that are going to get introduced. It's how things are going to get lobbied at all when the public doesn't have genuine access to the legislature. The legislature's hearings and everything are going to be held virtually. And when you have that limitation where you can't just pass somebody in the hallway, you can't send them a note, they can more easily stall you and push you away, that is really going to make things more difficult. And I think that the leadership of the caucuses on all sides are trying to minimize the number of things flying back and forth so that we can get things passed more successfully that are higher priorities. But you've got 147 legislators, and trying to make sure every legislator sticks by those goals to 2 or 3. But honestly, that's the first time I've actually heard that. So, how much it's actually going to happen, I seriously doubt it. Because everybody's real excited about making progress now that we have the presidency back and that we can pick up where we left off many years ago. It was very clear that President-elect Biden, isn't that great to say? President-elect Biden wants to have a public option in the Affordable Care Act. And so after they strengthen these other provisions, that will be the next big thing that they'll be pushing, is to build in a public option. Meanwhile, it was also really clear that they're going to be, the President-elect Biden will be working and had set up a group to work with, and especially with Senator Bernie Sanders, to advance how they're going to transition to the next steps. Congressman Adam Smith cautioned us very clearly that it's really important that these areas of price controls will be really critical. And he made it really, really clear that while there's a strong consensus in Congress to strengthen the Affordable Care Act, that we have to make sure that the price controls are going to be a big part of whatever happens. Because otherwise, if there are no price controls, as he put it, the Medicare for All would be bankrupt in a year without price controls. And again, we can talk at length about, you all know stories from your own family and friends about how huge variances are when it comes to the price of care.